Thank you, Mr. Chairman. And Secretary Becerra, it's good to see you here again. And I first want to thank you for coming before our committee to discuss the fiscal year 2023 budget priorities of your department. One of the first things I would like to talk about with you is telehealth. And what we have seen throughout this pandemic are the benefits that telehealth has been able to provide so many patients. As the pandemic winds down and society begins to return to normal, many of the telehealth flexibilities that were put in place as part of the public health emergency are still being utilized in positive ways. As you know and mentioned in your testimony, in the FY 2020 Omnibus, many Medicare telehealth flexibilities were extended for several months after the end of the public health emergency. I've heard from patients and providers alike about how much the flexible telehealth provisions have helped them. My district is very rural. If some patients are able to conduct telehealth visits when it is applicable, it can save them time and, with gas prices these days, a lot of money too. If there is one good thing that has come from the pandemic, the expansion of telehealth has made healthcare much more accessible to many patients. And I'm concerned about that accessibility if these telehealth flexibilities are not permanently extended. So my question is, as we wind down this public health emergency and Congress begins to consider the permanency of telehealth flexibilities, what do you see as the best way to preserve and even potentially expand telehealth availability to patients moving forward?
Congresswoman, thank you for the question. And everywhere I've gone in communities that are far more rural than urban areas, you can see the value of telehealth. We will work with you to try to make sure that we extend permanently some of the provisions that we've been able to employ during this public health emergency. So, for example, letting a person's home, a patient's home, be considered the site of the care makes it possible for us to extend reimbursement to those providers for providing care to those individuals. That expires, that ability to do that expires once the public health emergency is pulled down. And so we look forward to working with you to make sure that we've learned from the lessons of COVID, what works and doesn't work, and we move it forward. And I simply have to add, because we know someone's going to try to game the system, that we ask you for your help to make sure that the accountability measures, to make sure that there's program integrity to telehealth are there so that we don't let the bad apples ruin it for everyone who needs telehealth.
Thank you. Next, I would like to talk to you about an issue I discussed last year. When this committee discussed your department's FY 2022 budget request, I made clear how concerned I was that the department decided to forego 40 years of bipartisan precedent and remove the Hyde Amendment from your budget request. You responded to me that ultimately it's Congress's decision what will be included in the final bill when it comes to the issues of the Hyde Amendment. My Republican colleagues and I made it clear that any appropriations legislation that does not include Hyde Amendment protections will not gain our support. And the Hyde Amendment has been renewed every year on a bipartisan basis. Just last month, on March 9th, it passed the House of Representatives again with a Democratic majority and was signed into law by President Biden in the Appropriations Omnibus for the fiscal year 2022. That is why when the president's budget request for fiscal year 2023 was released last week, I was disappointed to see that the Hyde Amendment and several other longstanding pro-life provisions were again weakened or removed. Since 1976, the Hyde Amendment has saved over 2.4 million lives. This policy also reflects the views of nearly 60% of Americans who agree that taxpayer dollars should not be used to fund abortions. My question to you is, as the majority of the American people continue to oppose their tax dollars funding abortion procedures, and Congress has made clear that the Hyde Amendment protections are remaining intact, why does the administration continue to try and repeal this 40-year-old bipartisan provision and force Americans' tax dollars to fund abortions?
Congresswoman, thank you for the question. Having served 24 years in this body, I can tell you I'm very familiar with this issue. At the end of the day, you all will decide what our budget looks like. This proposal put forward by the president is his effort to try to let you and the American public know where he'd like to go. I'm a firm believer that a woman is the best judge of how to provide for herself and her health care, and making that decision along with her physician, not with politicians. And so when it comes to the issues of abortion, I know that there are deeply held beliefs. We may not always agree, but what we should do is agree that everyone should have access to the health care services they need. And at the end of the day, you all will decide what the president's budget looks like.
Again, thank you for your time, Secretary. Mr. Chairman, I yield back.
Thank you. The gentleman from